Welcome to the September meetup for Workplace Wellness Ireland. I'm delighted to welcome our brand new partner this evening, AJ Products. AJ Products are Ireland's leading office furniture retailer, and tonight they're showcasing a desk bike and a sit-stand desk, and I had to go earlier and I must say it's absolutely fantastic. I think it's the future of office and ergonomic furniture. So AJ Products are joining Spectrum.Life as partner sponsor for the event series, and they're both supporting the growth and development of Workplace Wellness Ireland, so a big shout out to them for that. Our theme for this evening is education and workplace wellness, and I'm delighted to welcome a panel that has experience of developing and participating in third level courses in the area of workplace wellness. We have Dr. Sarah Jane Cullinane from Trinity College in Dublin, we have Trudi McHugh of Laya Healthcare, and we have David Casey of DeCare Dental.
I want to branch away from the health and safety side of things, which is where my background was originally. As an occupational health nurse, that's traditionally the background we use. And I saw this course in Nottingham and it said workplace health and wellbeing, and I thought, that sounds fab. I looked a little bit further, and because it was an online course, that was particularly attractive to me. I genuinely absolutely got so much from it, and it changed my confidence in work and my ability to, talk to senior leaders within the organisation about what needs to be done from a work perspective to improve somebody's health, because it's not just provide a yoga class and then you've got a healthier workforce. It comes down to, I know this is Sarah Jane's, it's your policies, procedures and practices within the workplace that are the core fundamental with workplace health and wellbeing. If you haven't got them right, everything else is just a sticking plaster.
I look at the world as a completely different place from doing the Masters. I, from a medical background, kind of would have once thought that health and was very biomedical and very kind of disease focused, and now I look at it as where we live, where we work, where we grow, where we love, that health is so layered, and it's the workplace, it's our communities, it's society, it's policy, I completely look at a different avenue of it's not linear, it's so multidisciplinary.
And when I was on maternity leave a couple of years ago, at that time our then head of student services at Trinity was doing the rounds around the campus, meeting the heads of schools to tell them that basically we were having a bit of a crisis within Trinity where our counselling service is just completely inundated with referrals from tutors and staff of the students, and they couldn't cope. I'm sure they wouldn't mind me saying that, and that we needed as a university to come up with a more preventative strategy, where we would still have that service of course for students, but we're not just letting it go to that point only, that we're teaching them as part of our programmes how to look after themselves, about self-care.
In terms of the courses you've done, I'm just wondering when HR or management are engaging with you guys about potentially rolling out a wellness programme, how have the courses you've done affected your approach to that conversation?
The collaboration has increased massively over the last couple of years, and that's really what's key, and that's what the drivers are from the course I've done, is the integration of wellbeing into each and every pocket of the organisation.
What has been your biggest learning to engage the non-engaged, or the eye rollers, or the people who just really are not into well-being in general?
The biggest thing is letting people have time. If they say they've got a class they want to go to, you let them go to that class, because they're going to work really hard up to the time that it is to go to the class, because they know that that's what they want to do. Don't be afraid to give people the autonomy to make the decisions for their own health either.
It's one thing I always say to organisations is ask the question, whether it be a Google form, survey, whatever format you're using, but ask the question, and from anyone who's done the workplace wellness, we're speaking the same language here today, but it's ask the question, what is health? And ask your staff what health means to them. But one of the things with mental health and positive promotion of mental health in the workplace that I would ask organisations is, jump back a few steps and actually tackle stigma, because there's no good having a policy of mental health and having yoga and having mindfulness and having emotional intelligence and resilience and all these brilliant skills that are out there, but jump back in your organisation and ask yourself, have you done something on reducing stigma in the workplace? Because if people, without the stigma being lifted and without kind of tackling that at the start, people won't speak up, people won't engage in EAP programs, people won't talk about it. Don't be careful not to jump too far down the line. There's a kind of a challenge that needs to be overcome in that with engagement as well. So.
You just can't beat getting data from your staff in terms of quant and qual on an anonymous basis. It's just worth its weight in gold in the mental health piece, because that's where people can be really honest about mental health. So when they don't have their name to it, you know.
Brilliant. And a huge thanks to everyone in the audience for coming along and supporting the community, because this is about you and it's about sharing and learning. So without you, it doesn't exist. So thanks so much for coming along.